Hi, iPrevent viewers. This month is Substance Use Prevention Month. We've spoken a lot in past videos and podcasts about substance use and recovery and defined them both. If you want a refresher, visit iPrevent.org for all of our content.
This time, we're going to talk about prevention of substance use and why many youth find themselves using substances of all types. The Louisiana Department of Health shared that according to 2017 Youth Risk Behavior Survey, 19.3% of high school students took prescription pain medications without doctor's approval or not as prescribed, and 9.6% of high school students claim to have used heroin one or more times in their life.
With opioid-related deaths in Louisiana reaching 401, including 382 opioid poisoning deaths, it's important to learn about substance use prevention, especially for youth. Why do youth use substances?
What could lead someone into using substances? There are many factors, including environmental, mental health, and others.
Some things that could lead to behaviors like substance use are ACEs. ACEs is an acronym for Adverse Childhood Experiences. The traumas that we deal with in our life could greatly affect our health and behavior outcomes, including whether or not we as youth begin using substances.
According to the CDC, ACEs includes emotional, sexual, physical abuse, violence or mental illness in the household, and parental or familial separation from divorce or incarceration, all before the age of 18 years old.
Studies show that compared to those who have had no ACEs, people with ACE scores are 2 to 4 times more likely to use alcohol or other drugs and are likely to start at an earlier age. People who score 5 or higher on ACEs assessments are actually 7 to 10 times more likely to use substances, especially by injection, and are likely to report being addicted to those substances. Some studies have also found that people who have experienced childhood trauma report more chronic pain and use more prescription drugs. People who have experienced 5 or more traumatic events are 3 times more likely to engage in harmful use of prescription pain medications. Prevention of drug use.
We all have different stories to tell, and for many of us, ACEs are a part of our story. Knowing that those of us who have experienced these traumas are at higher risk for behaviors like substance use disorders, it is very important that we work hard to prevent it. Here are some ways. Find alternative coping mechanisms. Therapy. If you realize that you may have past ACEs in your life, seeing a therapist is a good way to relieve and express yourself without using any substances.
Other coping mechanisms could include being active in the arts, increasing physical activity, and so much more. If you're 13 to 24 years old, feel free to express your art with us on our radio station. Get educated. Learn before you do. iPrevent teaches about substance use, HIV, and hepatitis C prevention in fun and interactive ways with our social media posts, podcasts, events, radio, and so much more. Make sure to check us out on social media at iPrevent_OHL. Plus, the CDC and SAMHSA and many other trusted organizations have plenty of online resources that are just a click away. Evaluate relationships and influences, like music that promotes substance use. Seek positive friendships and other relationships with people. Avoid those who encourage or pressure you to use substances or even use around you. Some situations are inevitable, meaning you can't always decide who is in your life and what they do. But if you can connect with people who want the best for you, do so. What to do if you or someone you know has already begun using substances.
iPrevent advises you to continue to not only find better coping mechanisms, educate and evaluate friendships, but also to connect with an organization like Odyssey House Louisiana for all of your health needs. Check our calendar for the Revive Survive overdose prevention trainings on overdose and naloxone here at OHL.
Check in with us at Detox. If you or your loved one is ready to turn a new leaf, start with OHL's Detox on 4730 Washington and follow through with treatment with OHL short-term residential care. Call our outreach number for more information and how to get connected with all of our programs at 504-418-4955.
Substance use is not anything to take lightly.
Let's come together as
youth
and grow stronger in our fight against substance use disorders despite our adverse childhood experiences.
That's a wrap. Make sure to share this information with your friends, family, and colleagues.
I prevent substance use. What do you prevent?